This is Java Island, and this is Yogyakarta that ABC next year will be held. And then this is Jakarta, and this is Purwokerto. So this is the middle, in the middle between Jakarta and Yogyakarta. Okay, learning, empathy, and compassion. Doctors are required to understand patients' emotional and psychological aspects while applying scientific knowledge and skills in clinical practice. Empathy and compassion are commonly regarded as essential attributes for a doctor. Unfortunately, the science and technological advances are considered to widen the gap between doctors and patients. The role and the relevance of empathy and compassion in medical educations have tended to be unquestionably assured. And actually, empathy has been included as part of the core competencies according to the standard of competencies for Indonesian physician, or the so-called Standard Kompetensi Dokter Indonesia (SKDI). It is stated that Indonesian physicians should be empathetic to the patient and the family within the process of communication. Those are the reasons why we try to insert the topic of empathy and compassion into the curriculum. Inserting the topic of empathy and compassion in the curriculum has become a challenge for medical schools in Indonesia. In medical education, there is tendency to insist that any learning activity should contribute to the students' development of concrete and measurable competencies. It becomes complicated, whereas the quest for measurable learning outcomes may not always be easily compatible when it comes to the effective mastery such as empathy and compassion. Moreover, there is no national consensus nor standardized curriculum in Indonesia. So there is also lack of empirical evidence in the effectiveness of the insertion of empathy and compassion in the curriculum of medical education. So we have many resistance from faculty because many faculties don't realize how important bioethics, empathy and compassion in the medical education. So we developed a block of bioethics and medical humanities in our new curriculum of 2014. It's located in the third semester, and the length is 3 weeks with the continuous free credit for the block of bioethics and medical humanities. It has the learning goals are encourage students' sensitive appreciations of the ethical dimensions of life, contribute to develop students' abilities to listen and communicate to others, contribute to develop student skills in thinking critically and reflectively about their knowledge and experience. This is our curriculum map, and this is where the block of bioethics and medical humanities is located. This is in the second year and the first block. Okay. For the topic of empathy and compassion, we develop some methods. There are lectures, small group discussion, movie sessions, and community service program. And this is the schedule of bioethics and medical humanities. This is the lecture, which is given to the students. Movie session. Movie session help the students to value because the empathy and compassion, because movie can capture the sociological and psychological aspect of the story inside the movie. And then we have community service program that I will explain. Community service program is a program that collaborate with 2 orphanage, 2 house of elderly, 3 school for disabled people, 1 rehabilitation center for alcohol and drug user, and 1 non-government organization which concern in education for the poor. 120 students divided into small groups, and they assigned to have their interaction and give every social worker in 3 days. And the assignment, we assign the student to make reflective writing and also write inspiring stories. And this is the picture. This is the picture, students' activity in the orphanage. So they, together with the children there, they are learning mengaji or reading Quran, and then they made some group activities like moral games. This is students' activity in house for elderly. They help to do daily activities, and they make some activities like dance and gymnastics for elderly. And then this is students activity in school for disabled people. They help the teacher to handle the class and also make some moral things. And then this is the school for it's primary school for the poor children. This is one of the house of the child, and this is the student activity in rehabilitation center. It's poor because they don't want to. They don't give any permission to publish their photo. And for the evaluation, we evaluate students' activities by analyze their reflective writing to know what and how they learn in the community service program. And the results, students' opinion about the program. The students responded enthusiastically to be involved in the community service program. They were very happy, valued the program as they could have first-hand experience with community service to learn to help others. This is one of quotation. I felt excited because I could interact with them, could share knowledge and happiness to other people. And students acknowledged that their experience of taking care of a vulnerable group of people for 3 days might have impacted them to understand the meaning of community service. They can learn empathy and compassion better in this learning situation. They had large opportunity to feel and express empathy when they met and interviewed people with special conditions. And one of quotations says, I think this program was success to promote empathy and compassion in our life. It could be seen from our attitudes. We did not care one another before, but here we became different, more patient and very vulnerable person. Students' emotion in this program. Some students felt happy to serve others' needs. They valued that their short and simple activities in the place they worked were very meaningful for others. Some students felt sad because they had difficulties to communicate to the disabled, even they had already learned sign language. Some students felt touched when they saw the spirit of the disabled, how they struggled to reach their desire. I felt touched when I attended the ceremony without anthem. The leader could not speak clearly, but the teacher said that he was the clearest speaker in the class. Students learned to define empathy and compassion by their experience. I tried very hard to find the ways to make them happy. I wanted them to be happy because I felt happy when I saw they were happy. I did not know why I felt this way. I thought this was compassion. I wondered how they lived their life. They could not hear anything. Wasn't it so lonely? I could understand it. If I were one of them, of course I would be very happy if there were many people around me. Is it empathy? Students learn how to communicate with others through putting themselves in others' position. They learn to be more patient and practice active listening. They understood that communication not only occurred by words. When I tried to put myself in their position, I felt sad. I prevented myself from doing or saying something that would hurt them. This program presented a very diverse perspective on the human condition, and so students tried to know, understand, and appreciate a belief system other than their own. They became open-minded and also critical to deal with others' values. They became more sensitive, tolerant, and humble. Negative thinking would hinder the truth. Before this program, I thought we had to stay away from them. But then I realized that I could learn from them. Their spirit to be cured with an entire complicated environment around them could be inspiring for others. And student also learns to differentiate compassion from discrimination. We should not judge them too much. They could do many things by themselves. Actually, they were great, very skillful. Sometimes they felt uncomfortable with special treatment we gave to them. I found that it were not we who understood them, but they who understood us. Students understood themselves more when they saw how they differed from others. Students felt thankful with their condition and so have been motivated for enhancing learning focus on being a better person. Students understood that they had limitation and also superiority. I was happy that I could meet them here. They made me realize that I had to thank God for all I had. I regretted complaining too much. I should keep working harder and never give up. I knew I can do it. Community service program helps students to orient their future medical practice within the holistic approach of the patient and community. They also had lessons learned to improve positive attitude in their daily life. I wanted to be a person who could understand others, appreciate life, and care for the environment. We have some limitations. Some students say that they did not have sufficient time to learn in community service programs because it's only 3 days. I was happy to join the community service program, but I did not think that I learned empathy and compassion as learning objective stages. I did not know them in depth. I thought I did not have sufficient time to interact with the people there. In the conclusion, students respond enthusiastically to be involved in the community service program. Students consider that the program is useful to promote the ability to weigh and understand others' needs. Students were satisfied that they could express empathy and compassion to others. If empathy and compassion are taught in the right way and in sufficient time, they become valuable topics in medical education. However, the structure of teaching medical humanities, including empathy and compassion in Faculty of Medicine, Universitas Indonesia, is still under discussion and will always be improved. This is the reference. Selamat for terima kasih.
Thank you, Miko. Any questions? Yes, please, Daphne. Thank you.
Thank you very much. Good presentation. You've taken a lot of trouble over preparing and executing this program. I was interested particularly in your teaching of empathy and compassion. You have it as a topic. And one of the things we learn more and more about medical education is that students need to learn intelligence of the heart. How do you go about the methodology in this? Thank you.
Actually, we conducted many experiences in this, and it's not easy in the preparation because we have to have a discussion how to make the program effective for the students. The people in the institution, in the social organization is very helpful. And we know that we don't have sufficient time, and we just hope that from the method that we develop, like lectures, and then a small group discussion, and then movie session and community service program will help students to value the many ethical issue, many ethical value in their life. Is it answering your question?
The last slide you said, also I wasn't expecting that to be there, but in your evaluation you said that these two, still under discussion and will always be improved. So I was wondering what exactly could not be expressed, could not be taught in empathy and compassion that you need to keep on revising it. How did you go about teaching these? Was there some particular methodology involved?
Okay, actually we give assignment to the students to write a reflective writing, and from their reflective writing we assess how students learn from the program. So we can see that students learn a lot in this program. So we hope that we can maintain this program, and we hope that we receive many input from the social organization, so we always can improve the program.
Okay, yes, Marcella, please.
Okay. It's very awesome to come here because I felt that what I learned from you and the Filipino is that the developing country make use of so much of what they have, the people, the community, and that illness is not an individual problem, it's like a community problem and a community support. And this is something that we have to learn. And we have become very individualistic as a society. So illness is like a problem, the most we give a support group. But here what they have shown us is really empathizing. And this reminds me of the course in Belgium that we visited this place called Stu, whereby the nurse have a role reversal. They put themselves in the shoe of the patient and to live the life as a stroke patient so that they will come out better in their care and the ethos of care. And I think fundamentally you are promoting community care. Thank you very much.
Thank you.
Thank you. Marcella now, please.
Thank you for your presentation. A question. Do you teach in the empathy course and the comment? You have an opportunity if you apply a Jefferson tool and make a measure in the beginning of the course and the end of the course, and you can build better the competence that you developed in the course, because the Jefferson tool is a moral tool that is work-proof, and with this element we can to know if the competence that you develop in your course are sufficient or need more background.
Okay. Is it about the assessment? It's about the assessment. If I'm not wrong, you asked about the assessment to evaluate does the students sufficient in this course? Okay. Actually, we always improve our program in bioethics education. And the problems until today, the biggest problem until today is assessment. And the same as other medical schools in Indonesia, that we use MCQ, multiple choice questions, which is very difficult for bioethics. And we are trying to make a combination with this assignment, reflective writing, and the inspiring story that they write. And it's always evaluated to be improved in every years. Does it answer your question?
Yes, I know that you have the national evaluation, but when we teach, we can to know if our student developing the competence, and maybe sometimes we can to propose in another time or work with them.
The competences before the program.
No, when you teach in the activities, the strategies, the activities that you use.
Okay, actually we didn't do any specific tools to assess the students before, but after the programs, we use the essay examination, and also we give them assignment.
Yes, in my country, the national evaluation, the measure is about the cognitive.
Yes.
But we need to one measure the moral that like the values that we teach, and this tool that I have to mention is an opportunity that I use for this the evaluation. And there are the other moral tool is the color, the final issues test, but the measure is about social moral development, and this other tool that we can use for the measure the values.
Okay, actually we didn't develop any moral tools, so maybe we can have some more discussion to develop these tools. But maybe this is maybe it would be very difficult to because maybe in the next presentation maybe from Indonesia also maybe can have some suggestion about this. Okay. Thank you.
Thank you.